Melanoma is responsible for approximately 9,000 deaths per year in the United States. Anyone can get it, so pay close attention to this announcement. So, many of you might be wondering, what is melanoma? Well, melanoma is the most dangerous form of skin cancer. These cancerous growths develop when unrepaired DNA damage to the skin cells, which is caused by ultraviolet light from the sun, triggering mutations that lead the skin cells to multiply rapidly and form malignant tumors. Now, if melanoma is recognized early and treated early, it is almost always curable.
Everyone is at some risk for melanoma, but increased risk depends on several factors: sun exposure, number of moles on the skin type, and family history. For example, atypical moles can be precursors to melanoma, and having them puts you at increased risk of melanoma. Heredity plays a major role in melanoma. About 1 in every 10 patients diagnosed with the disease has a family member with a history of melanoma. If your mother, father, siblings, or children have had melanoma, you are in melanoma-prone family. Each person with a first-degree relative diagnosed with melanoma has a 50% greater chance of developing the disease. The most general cause is sun exposure. UVA rays are dangerous to the skin and can induce skin cancer, including melanoma. For example, blistering sunburns in early childhood increase risk, but cumulative exposure may also be a factor. What are some symptoms of melanoma? Well, here are some tips on what to look for when examining your skin. Take note of any new moles or growths and any existing growths that begin to grow or change significantly in any other way, or lesions that change, itch, bleed, or don't heal are also alarm signals. Dun, 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 dun. The first signs can appear in one or more atypical moles. That's why it's so important to get to know your skin very well and to recognize any changes in the moles on your body.
Diagnosing melanoma can be a difficult task even for a trained dermatologist or physician. Usually if a doctor is suspicious of something, he or she would probably want to perform a skin biopsy, in which tissue is removed from the skin and examined under a microscope by a skin analyst specialist. Now they would also want to inspect your lymph nodes because they would probably want to determine whether any cells have traveled beyond the initial state. As of now, the only true effective ways of treating melanoma is through surgery and chemotherapy, but there are also many ways you could try to prevent getting melanoma. These methods include covering up with clothing, seeking shade especially between 10 a.m. and 4 p.m., applying water-resistant broad-spectrum UVA/UVB sunscreen with an SPF of 30 or higher, and also avoiding things such as tanning beds or tanning oil.